I am Alyssa Macariola from BSM3E Group 2B. Together with me are my fellow group members, Casey Kent Lorilla, Rina Ruth Joy Malayo, Noemae Oganera, and Kyle Bryant Palparan. And right now we're going to discuss our research called Correlation between Preferred Study Approaches to Learning and Academic Success in Nursing Education. Now let's proceed with the introduction. So, in this study, it investigates the relationship between preferred study approaches and academic success in nursing education. It aims to provide insights that can help nursing students adopt effective learning strategies. This study emphasizes the unique aspects of nursing education, which includes evidence based practice, simulations, return demonstrations, clinical exposures, and case studies alongside traditional lectures. And for the gap, the study applied a quantitative approach which is useful for monitoring changes but fails to reflect students' complex experiences and views of their learning styles.
For our objectives, it's to determine the correlation between the preferred study approaches to learning and academic success in nursing education.
Next, for the significance of the study, this research may be beneficial to the following: Department of Education or CHED. The results of the study can help provide data and information to educators and policymakers on how to enhance educational strategies and student learning outcomes. School administrator. The result of the study will give administrators valuable insights into improving instructional strategies and offering a multitude of teaching tools to ensure high-quality education within the university. Clinical instructor. The results of the study will guide clinical instructors in developing more effective educational approaches that can promote better outcomes in clinical setting and academic performance of nursing students. Nursing students. The result of the study will help them acquire the needed knowledge and information by implementing their preferred learning style. Parents. The result of the study will motivate the parents to get involved in their students' academic performance. Lastly, future researchers. The result of the study can be used as a helpful resource that will assist them in conducting further related research on student preferred learning styles while also providing valuable data and information to all beneficiaries.
So for our theoretical framework, the study was anchored in the theories of David Kolb's experiential learning theory and Patricia Banner's novice to expert theory. The paragraph explains how Banner's novice to expert model and Kolb's experiential learning theory complement each other in nursing education. Banner outlines 5 stages of nursing proficiency, such as novice, advanced beginner, competent, proficient, and expert, while Kolb's emphasizes learning through experience and individual learning styles. Together, they highlight the role of experiential learning in academic success and clinical development, guiding educators in designing effective, student-centered teaching strategies. Kolb's focus on individual study approaches helps explain how nursing students approach their education, while Banner's model track their progression from novice to expert as they accumulate clinical experience.
For the theoretical and conceptual framework, with the use of David Cope's experimental learning theory and Patricia Benner's novice to expert theory, here we can see and deduce from the participants' demographic profile in terms of age, sex, year level, and GWA. The extent of the study approaches in terms of visual, auditory, reading or writing, and kinesthetic are also at play. And this leads to the correlation between preferred study approaches and academic success in nursing education.
For the hypothesis statement, below is the null hypothesis of the study. There's no significant relationship between the profiles and study approaches to learning. There is no significant relationship between approaches to learning and academic success of nursing students.
Research design. These researchers will utilize this method to gather data on the correlation between the preferred learning styles and academic success in nursing education. The method is deemed suitable for this study as it allows the researchers to assess multiple participants by asking data-structured questions to which participants will provide answer based on their knowledge and experiences.
For the participants, the researchers aim to have participants who will answer the survey. A stratified random sampling is used to determine the sample size of each year level. Participants who are selected randomly. Each participant will have an equal probability of being included in samples since a certain number corresponds to an individual in the alphabetically arranged class list. Moreover, the number generation process will be repeated until the desired sample size is obtained per section.
For our instrument, in this study, a standardized research questionnaire adapted from the approaches and study skills inventory for students or assist is used to answer the research objectives. The research instrument will have two parts, namely part 1 will be the demographic profile of the participants, including the age, sex, year level, and average in community health nursing, such as NCM 113 and NCM 104. The part 2 will be the question from Assist, a 52-item inventory which identifies three learning styles such as deep, strategic, and surface. The deep approach reflects an effort to seek meaning and understand concept, while the strategic approach involves goal-oriented studying and time management. The surface approach is characterized by route memorization and minimal engagement with learning materials.
Next, for our data gathering procedure, we will first obtain formal permission from the author to use their instrument. Secondly, we must identify participants from both level 2 and level 3. Thirdly, the researchers will then obtain informed consent. And after that, we will instruct classmates to disseminate the online survey questionnaires. Lastly, this will lead to the participants receiving thorough information about the study's purpose, procedures, potential risks, benefits, along with the ample opportunity to ask questions before agreeing to participate. Written consent will document this voluntary decision. Throughout the research process, confidentiality and privacy will be strictly maintained.
For the statistical treatment, following careful examination of the objectives of the study, here are the tools we'll use for data analysis. For the first objective, frequency and percentages will be utilized to determine the nursing students' demographic profile in terms of age, sex, year level, and general weighted average. Meanwhile, for the second objective, which aims to determine the preferred study approaches of nursing students, mean and standard deviation will be used to measure central tendency and variability. Furthermore, for the third, fourth, and fifth objective, mean and range will be utilized to determine the highest and lowest difference value of variables.
And now for the ethical considerations. In preparing for the study, the researcher will ensure that all participants will provide informed consent, demonstrating respect for their autonomy and understanding. Ethical clearance is guided and approved by Dr. Mary Beth Diva. And for respect for participants will be evident in the researcher's sensitivity to their values, cultural backgrounds, and individual preferences. Thus, transparency and honesty will be central to the researcher's approach, with clear information provided about the study's objectives and data usage. Moreover, the study will aim to benefit the nursing education by examining the link between study approaches and academic success in learning, adhering to the principles of beneficence and non-maleficence by balancing potential benefits with minimized risk.
Results and discussion. The demographic results showed that the majority of the respondents were above 21 years old, or 55.7%, with females comprising a larger portion, 73.6% of the sample. And most students were in their third year of the program, which is 56.7%. In terms of the preferred study approaches, the data revealed that the surface approach had the highest mean score, followed by the strategic approach, and lastly, the deep approach. This suggests that the significant number of students rely on memorization and route learning, likely due to the rigorous and content-heavy nature of nursing education. When examining the relationship between the demographic variables and study approaches, the findings showed that there were no statistically significant correlations between ages. This also applies to the relationship between sex and study approaches to the learning of the students, as well as the relationship between the year level in any of the three study approaches. A more noteworthy finding in the present study is the statistically significant positive correlation between surface and strategic approaches and the students' academic success, specifically in their performance in the community health nursing. Students who reported higher use of surface and strategic learning approaches also tended to achieve higher in grades. The negative correlation between year level and academic success suggests that a third-year student performed better academically than those in their second year. This may be due to the increased clinical exposure, better adjustment to the demands of the program, and more refined study habits, as noted by Lizio. As previously stated, students using surface or strategic study approaches generally achieve a higher academic success. In contrast, the deep approach shows no significant correlation with academic success, indicating that a preference for deep learning strategies does not have any meaningful impact on the student's academic outcome in this context.
For our conclusion, students employing surface and strategic learning methods tend to achieve higher academic results. Although crucial for clinical effectiveness, deep learning is linked to lower academic achievement. Female students are more likely to adopt surface and strategic learning styles. Current assessment practices might prioritize recall and memorization over critical analysis. The shift towards surface learning might stem from academic pressure rather than genuine intellectual engagement. This pattern could impede the cultivation of critical thinking and reflective abilities necessary in patient care. And assessment approaches should be redesigned to encourage deep and strategic learning in line with clinical demands.
For our recommendations, this will mainly tackle the academic institutions first and foremost, as given the abrupt change of the learning environment from online due to the pandemic and also the new curricula. This is necessary for school institutions to provide the faculty with fostering formative assessment, feedbacking, and scaffolding for professional development. Secondly, we have our nursing educators. In learning, teachers are the driving forces of a quality education. It may be necessary to hire more competent clinical instructors to supervise the exceeding number of students and to have a flexible and less demanding schedule because of the lacking number of teachers available. Thirdly, we will have our student nurses. Given that this research focuses on different study approaches of nursing students, it may be essential for them to have an evaluation per lesson or module in every subject or nursing subject. Fourthly, are future researchers. This study may be relevant and may serve as a related material for future endeavors and researches, considering the study material and the relationships between academic success and preferred learning styles of the student nurses in the nursing education.
And now for the last part of our study are the references. Here we have a QR code which can be scanned and all references are embedded in the PDF file.